Welcome to the Mental Health Commission of Canada session on mental health and wellness, modern solution for a 21st century challenge. I am pleased to introduce Louise Chenier as our speaker for the session. Louise is a program manager, workplace mental health at the Mental Health Commission of Canada. In her role, she works to eliminate barriers to employment for people with mental health problems and illnesses, and helps employers create mentally healthy work environments. Before joining the Commission, Louise was Manager, Workplace Health and Wellness Research at the Conference Board of Canada. While at the Conference Board, Louise participated in research on strategic human resources management, employee health, safety and wellness, and diversity and inclusion in the workplace. So over to you, Louise, to get things started.
Thank you so much, Tina. It's a pleasure to be here today with you to discuss a topic that's of a great passion to all of us here today and here at the Commission. How can we create a work environment that is mentally healthy? And so today I thought I could discuss with you and explore why is this an issue today in today's workplace? What are some of the tools that are out there that can make it easier for us to actually put in place a mentally healthy work environment? For example, the national standard. And how is it being used in the federal public service to create that work environment where we want to work, a mentally healthy work environment? Then does it work? This was a question that was asked by employers, by employees, by union members. When we first launched the standard in 2013, if we put our resources, financial and human resources, and put in place a comprehensive mental health strategy, will it have the outcomes that we want? So today I'll share some of the findings that we have from our research on case study research project. And finally, what can we do, all of us, in the workplace to better support each other, especially employees who experience mental health issues? But before we get started, I'd like you to think of your workplace, either the one where you work presently or one that you've worked in the past or you've discussed with your colleagues and see if this particular situation resonates. I'd like to present or introduce you to David and Helen. David and Helen are new employees to their organization. They've been with the organization less than 5 years, yet already they've been identified as future potential leaders of their organization. They have really hefty objectives and targets every month, yet they meet them with no issues. And they help their team meet their objectives. But what's more, they're really sociable, so they actually are well-liked within their team. But within the past year, both David and Helen experienced a really difficult time. David was diagnosed with cancer, and it was quite a shock for him. And when the doctor talked to him about his diagnosis and his treatment, he specified, you know, the treatment is going to be draining. It's physically very draining, emotionally very draining. And you work in a work environment that's really stressful, really fast-paced. This might not be best for your recovery at this time. And so he may want to consider taking a leave of absence from work and just focus on recovery. So David went to see HR, and platinum programs were in place. So he was able to take that time off and have financial stability for himself and for his family. But his colleagues found out what was going on before he left, and they came and offered support. Some shared stories and advice on how they had gone through the situation with a family member or with themselves, and they all offered help. Is there anything that we can do for you at this time? And when he went home for his leave of absence, they actually called him at home, just like it was practice for them to do, and stayed connected. You know, they talked about the fact that Janet, his supervisor, had retired. They invited him to her retirement party so he could actually say goodbye to her, right? Nobody expected Janet to retire. She'd been there since the beginning, but she decided she wanted to travel. He found out about the IT system that was horrible, but don't worry about it, because by the time you come back to work, the system's going to be fine, right? And not just that, but we'll have learned how to use it, we can teach you. He found out all those little social tidbits and those little information that bind us together as colleagues in the workplace. So although it was a really difficult time for him, he never lacked that psychological support that's so essential during a recovery. because some of his closest relationships were in the workplace. As adults, we spend 60% of our time at work, and he was able to maintain that. And he recovered, and he was able to go back to the workplace. And when he went back to the workplace, they actually threw a party for him with chocolate cupcakes covered with whipped cream, my favorite, so that, you know, he knew that he was really valued as an employee, that they were so happy that he had recovered and he was back. At the same time, though, Helen went through a really difficult time of her own. It started out that she was finding it difficult to get up in the morning and get dressed. It took all of her energy to make it into work. So by the time she was actually at work, she really had to focus on her work. She started isolating herself from her colleagues and staying in her office because these targets that were usually so easy for her to attain, they became overwhelming. At first she thought, well, I've been burning the candles at both ends, right? It's just fatigue from work. But eventually she realized, no, this is more than that, right? I better go see a doctor. And she was really surprised when she was diagnosed with depression. And the doctor said, you work in a really fast-paced work environment, really stressful. It's probably not the best for your recovery. You might want to consider taking a leave of absence from work so that you can focus on recovery. And so she went to CHR, once again, platinum program, and she was able to take that time off and focus on her health and not have any kind of financial instability for her family. But her colleagues had noticed changes in her behavior before she left, and they all assumed that this might be a mental health issue. But nobody felt comfortable approaching Helen and asking her if she needed support. Because what if they asked that one question that made it worse for her? What if she became emotional at work? What if she cried? Nobody felt comfortable, and they all assumed somebody else had more experience. Somebody else would actually talk to her. But nobody did. And when she left the workplace for her leave of absence, nobody called her at home, because once again, they didn't feel comfortable. What if they asked that one question you're not supposed to ask? And so she didn't find out about Janet, who was also her supervisor. She didn't find out about the IT system or any of the other elements of the workplace that had changed. So when she recovered, and she did, and she came back to the workplace, suddenly it was almost as if she was a new employee, but she knew everybody, right? It was very awkward. And once again, colleagues didn't come and ask her or celebrated her return or asked her if she needed support because, did you do that? Right? What if they made it worse? And so she didn't get the party and so forth, and she already felt almost like a stranger in her work environment. So you can see how for Helen, there was almost a lack of psychological support. With the best of intentions possible, everybody was so happy to have Helen back. They didn't want to be the ones to cause a recurrence, right, by asking that one question that caused a difficulty for her. But the very situation that the colleagues, that her manager was trying to avoid could have actually happened because of the lack of psychological support that she missed, right, during that time. Have you ever encountered that in the workplace? I've worked in this field for a long time, and I have to admit, apart from the commission, because I've been here reasonably a short period of time, I've seen this in every workplace that I've worked in. So today what I'm hoping is we develop a language, right, so that everybody feels a bit better about offering support. But I couldn't start a conversation about mental health at work or in society without bringing up, well, the stigma that surrounds any question around mental health issues in our workplaces. If employees don't feel safe, if they feel that they'll be judged negatively, if they, first of all, report or disclose that they have a mental health issue, or if they access resources in the workplace to better support their mental health, they'll never access those resources. And so we can have the best programs and the best interventions in the workplace, and they'll be completely ineffective unless there's an environment of trust. And so it's really important to discuss the importance of mental health openly in the workplace, the importance of mental health not only to the individual, but also to the organization, and the senior leadership visible commitment to do that. But there's another, or second facet to stigma. It's called self-stigma. And that's when the individual themselves, right, they can accept and they can support a colleague who experiences a mental health issue, or a family member, or a friend, but they can't accept it for themselves. It just doesn't fit within the identity they have of themselves. And so they might, for example, be experiencing depression, and one of the symptoms of depression is a sore back. And they'll go see their doctor for the sore back, but they'll never go see the doctor for depression, right, because they can't accept that they may be experiencing a mental health issue. Well, what if that individual is an employee? They're already experiencing self-stigma, and they think they'll be judged by their managers or by their colleagues. What are the chances they'll ever access the resources in the workplace? They're non-existent. And that's why we have to create that work environment of trust, that everyone feels that they can actually seek the treatment that they need in a timely manner. Because what if we treated everyone the way that we treat an individual or an employee with a mental health issue? Now, I'm hoping we don't hear this type of language in the workplace, right? But I'm hoping if I came into work tomorrow and I said, oh, Bob has taken another day off. You know, he had his heart attack 4 weeks ago, right? He's just lazy now. He's milking it, right? That would shock my colleagues, and I'm hoping every single one of them would stand up and tell me how wrong I am in my lack of knowledge, right? And would help me understand that for Bob, you know, that was a severe physical health condition, right? And that he requires that time to recover. Now, we may not quite hear that language with mental health at work, but what if we changed it to, for example, substance use or alcohol misuse? We may not call it laziness, but don't we hear sometimes that they could get over it if they had the willpower to do so? And yet, those are conditions that are medical conditions. They are physical changes or a physical health issue in the brain. Their neurotransmitters have changed, how they work, and they require treatment, right? And so the same way that we would expect an individual who experiences a severe physical health issue has support, we should be supporting each other in the workplace for our mental health as well. So it's important to think about how we phrase things in the workplace to make sure that we're not being seen as potentially judging, so that people can feel comfortable accessing the programs and initiatives that we have in the workplace. Now, I think in society and in our workplaces, obviously, we sometimes have a binary vision of what mental health is, right? So I can be in the green, as we say, and I face risk factors because we all do, from our friends, our communities, our families, our workplace, and yet I have the strategies in place to be able to manage those risk factors, and so I'm healthy and I'm in the green. Or I don't have the strategies in place to manage these risk factors, and I don't have the support to do so, and I fall into the red zone, and I'm ill. But do we think of physical health that way? So for example, what if I woke up this morning and I have a headache? Would I consider myself being healthy or ill? No, I'm responding to something in my body, right? It could be that I didn't sleep enough or I didn't drink enough water, and I'll take capsules possibly or drink water and I'll be fine. I won't think about being healthy or ill, right? Well, it's the same thing with mental health. The fact is it's a continuum, and I could be in the green and encounter risk factors and have the strategies in place to manage them. And yet a new risk factor comes in and I start reacting to that risk factor because I don't have in place a strategy or the support needed to manage that risk factor. And if I do receive that support, or if I do develop a strategy to manage that risk factor, I can go back to the green. Or if I don't, I could go into the orange, right, and be injured, or even more, go into the red and be ill. But it's fluid, and I could go towards the green or towards the red, from day to day, from hour to hour, from year to year. But why is this important in the workplace? And why are we talking about mental health so much more in the workplace now? Well, it's because every single week in Canada, 500,000 Canadians will actually miss work, either a day up to the entire week, due to a mental health problem or illness. That's really significant. Not only for the workplace, where we lose that knowledge, right? We can actually have a negative impact on teams and productivity, but for that individual as well, who now loses that connection that they have to their workplace. And as I said, we're actually linked to our identity is linked to our work. And so losing that connection can actually have a detrimental effect on our mental health. And if we look at the incidence of mental health problems or illnesses in the population, we see that it's our younger employees who are more likely to experience a mental health issue, those between the ages of 15 and 40 years old. But that makes sense. And here I want you to look at the dark blue bars. But it makes sense because, of course, they're encountering a lot of new risk factors they may not have strategies yet to manage. For example, if it's a new job and the first job, and if there are managers here, nothing negative about that, but it's very stressful to face a manager for the first time. How about performance discussions? Very stressful. They could be in a serious relationship for the first time. They could be having children, right? And although those are wonderful things, they bring with them some stress. Or they could be buying a home and have financial insecurity for the first time, right? And so as they develop strategies to manage these risk factors, they actually can promote their own mental health. But it would make sense why there'd be a higher incidence of mental health issues and problems for our younger population. But I have to put my researcher hat back on here for a minute and talk about those employees who are older, right, 60 years and over. When they were growing up, right, in their adolescence years, in the formative years, we didn't talk about mental health, right? If a family member lived with depression, for example, it was a family secret. And we didn't talk openly about it to our neighbors, to our friends. It was kept silent. How likely are they to actually talk about mental health and to, as I was talking about self-stigma, admit that they may be experiencing a mental health issue because of that background, right? Much less likely. And in order to be in this chart, you need to have reported or you need to have disclosed that you have a mental health issue or gone to seek treatment. So they're probably even more severely underrepresented than other populations. So it's important to make sure that when we address mental health at work, that we address for our entire population. And now in Canada, when an employee takes a leave of absence due to a mental health issue, there's some serious connotations to that. About 30% of short-term and long-term disability claims in Canada are for a mental health issue, but they account for 70% of the costs of disability claims. That's significant, but there's a reason for that. First of all, I always go back to stigma. I always do. But like I said, if because of self-stigma or for fear of being judged by my colleagues, by my doctors, by society, that I don't admit or don't think or I don't want to admit that I may be experiencing a mental health issue, I'll go see my doctor for the sore back. That's a symptom of my mental health issue. I'll get treated for the sore back. I'll have a recovery plan for the sore back. I may actually go on leave of absence for the sore back, right? But as it's not getting any better, the doctor will do a secondary analysis and they'll come up with a secondary condition, which is really my primary condition. I may be living with depression, for example. Well, but now let's say it's taken 6 months before I get actual treatment for my condition. So that extends the length of an episode, right, and extends the costs. And for that individual, it's much more difficult potentially to get treatment, or the condition is worsened, right, during that time. But in Canada, there's also a shortage of healthcare professionals related to mental health, so counselors, psychiatrists, psychologists, especially in certain regions in Canada. And so usually when we think that we may be experiencing a mental health issue, we'll go see our GP. And it's our doctor who will actually do the diagnosis. But it takes an hour and a half to get the appropriate diagnostic or the appropriate name for the condition I may be experiencing. How many of us have spent an hour and a half with our doctors, not including the waiting room? That's not how the healthcare system is made or functions. And so usually what happens, you get a more generalized treatment, right? You might be given an antidepressant, and then they'll tweak it when it doesn't quite work until you get the right treatment. So that extends the length of claim. There's not a lot of things that employers can do about that, but it's to know that there's some reasons why a claim might be longer, and to maintain contact while the person is away, to connect them, to make sure that they still feel connected to employment. So what if we did nothing in the workplace, right? It's a personal issue. What if we did that thing? Well, we've already talked about the higher absenteeism rates, but there's also presenteeism. That's when an individual is at work and is counted as present, but because of a mental or a physical health issue, they're not able to function at 100% of their productivity, right? So there's a cost not only to the organization in the loss of productivity, but to the individual who may not be seeking treatment and may be at work, and just like we would with flus and colds, is sharing, you know, that, right? And so it's important to address it because there is quite a cost to the organization and the employee. We talked about disability claims, but I wanted to emphasize injuries and illnesses as well. So what if I worked in a high security position? So I'm a pole climber. Now I know nothing about this, I'll probably have the terminology wrong, but I'm a pole climber and I fix the electrical lines for hydro, okay? And although I'm present at work, I'm not able to be fully present at work, right? So I'm having issues with concentration, with the abilities to make decisions, organizing tasks because of a mental health issue. What are the chances that I'm going to cause a situation or I'll do an error that's going to cause an injury to myself or to a colleague? Much higher. And so occupational injuries and illnesses are significantly correlated with a mental health issue. But it's the same thing if I'm in the workplace and my job is not security conscious. I was saying that I was a researcher in my past life. I did a lot of data analysis. That was my incredible gift to wellness. So I did a lot of data analysis. I loved it. But what if I wasn't able to concentrate because of my mental health issue? What are the chances that I'm going to make mistakes in my analysis? That not only the employer is going to have false data and therefore act on false data, but that it could affect me professionally and my reputation professionally or my organization's reputation. So it's important to put that into context because there is a cost not only to the individual but to the organization if we don't address mental health at work. So what does this mean in the workplace? Well, in our workplaces, we have individuals who are healthy, who are able to manage every risk factor that they encounter at this moment. They have strategies in place or the support in place to be able to do so. And for these individuals, we have to put in place what we call wellness programs to maintain and promote their health, right? And to make sure that we reduce the risk of psychological injuries at work. Then we have those who are taking ad hoc sick leave, right? A day here, a day there, to try to recover, to try to manage their mental health issues. For those individuals, we need to put in place programs that help them stay at work, or stay at work programs. That might include accommodations, early intervention programs, and so forth. Because, of course, as we said, it's better for the individual, if possible and if it's safe, to actually recover in the workplace, right? It's good for their identity. It's protective for their mental health. And for the organization, we keep the knowledge. So it's really a win-win situation. And then we have individuals who have taken a leave of absence, right? Either short-term or long-term due to their mental health condition. And for those individuals, we need to put in place some return-to-work programs to help them return to the workplace quickly or in a timely manner, but in a safe manner, right, that try to prevent recurrences. And so our programs need to span our health profile within our organization. I always say this first part of the presentation is dark and dire, right? So I'd like to emphasize there are solutions, especially in the workplace. So first, and it's at the top of the cycle, we need to put in place a comprehensive mental health strategy that addresses all aspects of mental health in the workplace. Now, the Commission, the Mental Health Commission of Canada, we promote the national standard, which we helped release in collaboration with our partners, CSA and BNQ, the Bureau de Normalisation du Québec, in 2013. And really, it's a framework, and we'll talk about it in a minute, for a comprehensive mental health strategy. Why do we need it in place? Because it helps to change the culture, to make employees feel valued in the workplace, whether or not they have a mental health issue. Then we have to address stigma, because we can have the best programs in place in the workplace, but if people don't feel comfortable accessing them, if they feel they'll be judged, right, or it'll impact negatively on their career, they'll never access them. And so it's important to talk openly about mental health, the importance of mental health, not just for the organization, but for the individuals as well in the workplace, so that we try to reduce the stigma and make people build that environment we were talking about, the environment of trust. And finally, in order to make sure that both, Helen and David receive the same psychological support, what do we do if we think a colleague is in crisis, right, at this moment? What do we do? That's first aid, right? Just like if I fell down the stairs, which is highly possible because I'm clumsy, and I broke my leg, or we thought I'd broken my leg, I'd have colleagues who are trained in first aid, right, in physical first aid. That could help me. They'd stabilize the injury. They'd get me to the proper medical attention. In the same way, how can we help someone? For example, I'm presenting right now. I could actually have a problem with anxiety. If I had an anxiety disorder, would somebody be able to help me at this point, right? Stabilize the situation and get me the medical attention that I needed. That's mental health first aid. And those are just some tools that we can use so that everybody feels they can actually do their role that they have to create that work environment that we want. So the standard. Well, the standard was released in 2013, and it's a framework, right? They're tools, not rules, as we like to say. The standard right now is free from download. The address is there, and it's voluntary, although it is being used by arbitrators, for example, to demonstrate due diligence by employers at this time. So there are starting to be some legal implications, but right now it's voluntary, and it's meant to be so. Now, I always say, I hate saying this when there are commission colleagues around me, but the standard is 15 pages long, and unless you know what an ISO standard looks like, and if you've read it in the past, it's really hard to follow sometimes, right? And employers are finding it difficult to follow. What I always say about the standard is the appendices are rich. The appendices is what you want to look at, because if they talk about an audit, there's an audit tool in the appendices, and it's very rich in its tools. But if you want to put in place a strategy and really understand and give examples, then I always recommend that somebody use the implementation guide. That's 124 pages, and they turn the ISO language into employer language, as I say. It's much easier to understand and to read, and it's got great examples. But why use the standard? Because it helps frame our programs. And the standard itself is based on the 13 psychosocial factors that promote and maintain mental health at work. And then in the absence of these factors can actually have a negative impact on our mental health. But I bet you as I said that, very few of you knew what a psychosocial factor is, right? It's clinical language. As I said, these standards were written by clinicians. And so sometimes, what if I change the wording? And I said, what is the element in the workplace that needs to be there for you in order for you to be happy and engaged and productive at work? You know, that essential element that you need in your workplace to feel safe. I think probably an element came into your head. You had an idea float into your head. For me, it's respect. I need to feel respected, not only as an individual, not only for an employee or for my work, but as an individual, that I can bring my whole self to work and I'll be respected. Well, civility and respect is a psychosocial factor. And any of the elements that you came up with are probably comprised within these 13 psychosocial factors. And if you'd like more details about the psychosocial factors, there's a great website called Guarding Minds at Work that not only describe what the psychosocial factor is, so a definition and understanding of what it is, but also how to evaluate it in your workplace. And like I said, the standard is simply the framework in order to put in place a comprehensive mental health strategy within your workplace that includes specific and kind of overall programs, with general programs like wellness programs, to very targeted programs that target the risk factors that are unique to your work environment. Policies that are signed by senior management to show their visible commitment. Benefits, right, and to ensure that their psychological benefits are comprehensive. Training, both, like I said, general training like awareness sessions to very specific training. So for example, if stress is a risk factor, resiliency training might be a really good training to offer. And finally, I'm a researcher, I love this pillar, evaluation. How do we make sure that the programs we put in place have the outcome that we wish? And what's really a success story right now is federal public service is using this approach to put in place a comprehensive mental health strategy that's unique to the federal public service. And I think that's a success story we need to share across Canada. It's with the 22nd annual report of the Clerk of the Privy Council that mental health was identified as a potential issue or obstacle within the workplace, including the federal public sector, that could prevent an individual employee from really achieving success at work and thriving at work. And so in response to the report, the Federal Public Service, they put together a joint task force that includes unions, Treasury Board, HR, managers, and so forth, to put in place what does this mean in the Federal Public Service, right? How do we address mental health in our unique work environment? And they came up with 11 recommendations that actually align with the standard that we were talking about. But they also said that there was a lot of work already underway, a lot of success stories that we needed to share, that they might not have been aligned into a mental health strategy, but there was a lot already on the way or already done to address mental health at work. And that executives were key, that in order to put in place and implement a mental health strategy across the Federal Public Service, executives had to show visible commitment to this approach, or it wouldn't be successful. And I always emphasize the first recommendation. First of all, I love the wording. And as a researcher, I have to be careful with my language, but I would plagiarize this and share it across the country, because I think the wording is beautiful. And what is a psychologically healthy work environment? But I always stress that last sentence, because I think that's where the key is, that the obligation belongs to every individual in the workplace. There's a role for all of us to play in creating the work environment where we want to work, right? So for employees, for managers, for senior leaders, for union members, union leaders, we all have to work together to create that work environment we want to work in, a mentally healthy work environment. And with their second report last May, they provided more direction on how they were actually going to put in place their 11 recommendations. That's when they specified they were going to federalize the implementation guide that I talked about for the standard, called Assembling the Pieces. And that would be used as a roadmap for all of the different departments, and that they would create a center of expertise. At first, they were thinking about actually doing it for all Canadians. But then they said, no, our task is really how do we address mental health in the Federal Public Service. And so it's going to be able to provide guidance for anyone who wants to put in place a mental health strategy in the Federal Public Service. The strategy itself has 3 strategic goals. Changing the culture, we talked about that. How do we make sure employees feel valued, whether or not they have an experience with a mental health issue? Building capacities. If we tell every stakeholder in the workplace, for example, employees, managers, senior leaders, union leaders, that they have a role to play, do they have the tools to be able to do that role? Because if not, we're just adding stress to the situation. And finally, to actually measure and to report to make sure that it's not a strategy that can be put on a shelf, right? If you need to report on your outcomes, then you have to actually implement the strategy and to follow up and monitor. It's important to remember, though, that big changes happen one small step at a time. You know, I always say, how do you eat an elephant? Well, I've never done it, but I'm assuming it's like anything else. You would eat it one small bite at a time. And so we'll see progress, and we can see some right away, right? But we'll see it over time as well. Does it work? Like that, in 2013, when the Mental Health Commission of Canada launched the standard, that was a question that was asked by employers and employees. You know, does it work if we put all of this resource, you know, human resources, financial resources to putting in place the comprehensive mental health strategy, will it have the outcomes that we want? And so at that time, they started a research study where they followed 40 organizations as they implemented the standard to see, first of all, what are the challenges they'll experience, right? What are some of the solutions or best practices that we can come up with that we can share with employers? And does it work? Does it have an impact? And for that, they studied small, medium, large-size organizations, public sector, private sector, in every industry across Canada, and, of course, everywhere across Canada that we could, to see whether there were some unique factors that we had to take into consideration as well. So today, I'm going to share one of the case study results. The final results will be available in March. So these are interim reports, interim findings. There's a second one there from Bell that I'll skip over because of time, but the information will be there for you to read after, because you'll be receiving a copy of the presentation slides and they'll be posted on our website. So the Michael Garron Hospital, it used to be called the Toronto East General Hospital, and they put in place the standard in 2014 in order to better support especially the nursing staff, but all employees within the organization. As you may know, across Canada we do have some challenges when it comes to nursing and nursing staff. They encounter some very unique both physical and psychological risk factors, and because of that they often have to take time off. And so they're some of the highest absenteeism rates in Canada are in hospitals. So they were putting in place the standard to try to better support their employees. And so the first step in putting in place a standard is to do a gap analysis. Where are we now? Where do we want to go? And what are the risk factors, right, that we can encounter in our workplace? And so they identified the emergency department as being an area where there's a lot of risk for psychological injuries, specifically through vicarious trauma. Vicarious trauma is when, for example, I'm a nurse and I have children at home and a child comes in and who's been badly abused. I'm going to react to that, right? It's going to have an impact on my psychological health. And so they put in place an entire training program on how to identify signs and symptoms, but also identify those situations that may cause vicarious trauma, to put in place better support systems for the nursing staff, for the entire personnel of the emergency department. They put together a burnout checklist for the nursing units because burnout was definitely identified as a serious risk factor for this particular employee population. They improved their workplace violence programs. I don't know about you, but when I go to their workplace, the hospital, either I'm vulnerable or a loved one is vulnerable. I'm probably not at my best to be at my nicest and most respectful to the nursing staff or to the hospital staff. But it's also internal, right, where there's systemic situations that could lead to workplace violence. So they put a lot in place for the employees to try to promote and maintain their mental health and support them. Did it work? Well, the Michael Garron Hospital during that time period experienced a 7% decrease in overall healthcare costs. That includes short-term and long-term disability, paramedical services, and so forth. And so obviously employees were feeling more supported, and they didn't have to necessarily leave the workplace to recover if they experienced a mental health issue. And for them, one of the drivers was absenteeism, and the absenteeism rate dropped for their nursing staff from 10.7 to 6.6. Now, the data is a bit more longer term because the last time they had data was in 2008. So in 6 years, it dropped by 4 points. That's actually really significant for the organization. But it also kind of signifies that the employees were feeling more supported at work and were able to maintain their work. What they weren't maybe expecting as much is that, of course, employees felt more valued, so the service that they provided was better to their patients. And so patient satisfaction scores started going up. And as well, as I said, they were more present at work, they were better supported, and so the number of medical mistakes decreased during that time period. And in a hospital, one medical mistake is too many. So for them, that right there was the business case for putting in place a comprehensive program. So as I said, Val, the information is there, and you can read it at your leisure after the webinar. So the research study itself demonstrated that there were some key factors that could help with the implementation of a mental health strategy. And the two that were most in control of the employer was, first of all, leadership, right? Leadership commitment and support, an active, visible leadership support of the initiative, right? And that way, it kind of built that environment of trust we were talking about. Employees look up to their senior leaders, and they feel they're addressing mental health, that they support mental health, they feel better and less insecure in accessing resources, for example. But also, making sure people had the tools to be able to do their role. So psychological health awareness, right? Making sure that employees, that managers, that senior leaders knew what their role were, but had the tools to be able to do so. And in the absence of those two things in particular, it was actually hindering the implementation of a mental health strategy. Now, there are many key takeaways from the research project on what executives could do, for example. Show visible leadership commitment, engage all stakeholders, communicate about mental health in the workplace, and be examples of what is a mental health promotion, right? Making sure that they follow the same healthy behaviors, for example, as employees. The one I wanted to stress today, though, because it's one that all of us as colleagues can do, is actually recognize the indicators of mental distress and act. So as I said, mental health isn't a binary condition. It's actually on a continuum. But for every stage on the continuum, there is some changes in mood, in thinking, in attitude, in behavior, in performance at work, even physical changes that can actually highlight or demonstrate that an employee is struggling, right? They're having difficulties. It doesn't mean they're experiencing a mental health issue. It means that they're experiencing a difficulty of some kind and require more support. This is not a diagnostic tool, and we don't want it to be a diagnostic tool because, I don't know, maybe we do have doctors on the line today, but most of us in the workplaces don't have that knowledge, right? We don't have that training, and we don't want to start diagnosing in the workplace. But we need to know when a colleague may be experiencing difficulties and to offer support. So I could, for example, if Tina, for example, I was concerned, I'd go to Tina and I'd say, oh, hi, Tina, you know, are you okay? I've been noticing lately you look really stressed and you're rushing around a lot. You know, you're not talking with us when having coffee or lunch. You know, I'm really concerned. Are you okay? Is there something I can do for you? And perhaps Tina will feel the trust to be able to tell me if there's something going on. And at that point, it's to actually have a tool in our pocket, like I say, be able to offer resources that can help. So, for example, if I'm a colleague and I'm approaching Tina, I may be able to direct her to the EAP, the Employee Assistance Program within the organization. If I'm a manager, I may have a list of resources that are available to Tina. But in this way, Tina actually will feel more valued. She knows somebody's actually concerned about her health, about who she is. And like I said, it could be for a completely different reason than a mental health issue, but she knows somebody's concerned for her welfare. Does it work? So if you don't mind, when I was talking about the research project and the findings, I always find that those findings are much more organizationally based. And that's to be expected, because at the individual level, there's a lot of confidentiality, and it's hard to get that data. So would this work in the workplace? So if you don't mind, I'll share a story that happened about 3 years ago. I was working at the Conference Board of Canada, and as soon as I entered the Conference Board of Canada, I knew what position I wanted, right? It wasn't to be president or vice president or director, because unfortunately these individuals don't play with data, and I'm a data geek. So I knew I didn't want that. What I wanted to be was principal researcher, because you got paid to work with data all day, and people left you to do it because you had already demonstrated that you could do it really well. So you have all the control, and you get paid to do it, and you get to play with data all day. My dream job. And so I've hinted at it 3 years ago. Yes, it happened. I became principal researcher. And so that was fine, a senior researcher. And I started, well, obviously I was very, very happy, but the entire team was happy. We were doing the dance of joy, because it also demonstrated that the area, the field, the wellness, was important enough to have a senior researcher, right? And so the entire team were celebrating. And I can tell you right now, I know the minute that the dance ended for me, and that was 2 days later, and it had nothing to do with my work. 2 days later, my sister called me at work and told me that my brother-in-law was ill. She thought he was ill, and she needed to bring him to the hospital. My brother-in-law is quadriplegic. He fell off a roof when he was 18, and sometimes his health can vary. And so we have a support system in my household where, because they have 3 children, when they think Paul might require care, I come in and help with the kids. And so that's what happened. She said, you know, I don't think it's important. I think he just has an infection. We'll probably be given antibiotics and go home, but I need to make sure he's okay. And so I went and babysat. And of course, I brought every bad thing known, and I know this is the bad way of babysitting, but I didn't know at the time. I was young, right? I brought in the pop and the chips and the movies and the videos, and we had a blast until we found out that the situation with Paul was much more serious than we thought. And so Paul had a pulmonary infection, and by the time he went into the hospital, one of his lungs had collapsed. By the time that they were able to diagnose that, his second lung had collapsed. He lacked oxygen, and he had a heart attack and a stroke. And so he didn't come home that night. He didn't come home for another year. He was in ICU. The healthcare system, we have a wonderful healthcare system in Canada, but it can be very difficult to navigate if you need total care. And so at that point, my sister needed to stay at the hospital with Paul to make sure he got the treatment that he needed to recover. And so from one second to the next, my sister's children, my niece and my nephew, lost both their parents. And I became substitute mother for 3 wonderful teenagers, triplets, who were just starting high school. But, you know, it's normal, everyday. It's not normal, but it's an everyday occurrence, and so you go into survival mode. You need to. And so I would wake up in the morning at 5 o'clock in the morning because I still had a job that was much more demanding. And so I'd work for an hour and a half, and then I'd get the kids up and get them ready for school and get them to school, and then I'd go to work. And if during the day we thought Paul would die, and that happened quite a bit, especially at first, I'd get the kids from school. I'd get them to see their father in the hospital to say goodbye. And then, thank goodness, the situation always stabilized itself. Paul is still with us. And either the kids could go back to school or they'd go home, whatever they felt they could do. Most of the time they went home. They couldn't deal with school the rest of the day. And so I would help them go through whatever emotional situation they were going through at the time. But even on days that Paul was doing well, I had to be out of work by 3 because I had to be home to help the kids when they came home from school. We didn't want them to feel unsupported during this time. I would bring them to see their parents at the hospital for a few hours. They could have a conversation and have family moments. And then they would go home, and I would help them with schoolwork and everything that entails being a child, and they would go to bed at 10. But I hadn't worked, and I had a new job that was really demanding. So I'd turn on my computer, and I would work until 2 or 3 o'clock in the morning. Then I'd turn the computer off and wake up at 5 and start over again. And I did this for quite a few weeks, and I didn't think at the time that things were maybe much more difficult than I thought for myself, because all I kept thinking was, what do I need to do at this moment so the kids are safe, so that Lise is supported, that Paul was supported. By the time we got to the 4th person, which was me, I was already back at the kids, right? And it was a colleague at work who noticed that there was a change in my behavior. I started isolating myself at work because, of course, when I was there, I had to work. I looked really stressed. I rushed in and out all the time. And a sign that's not in this chart that is uniquely mine is I started wearing colors. Well, my normal attire, I wear black, grays, whites. And if I'm feeling really daring, I wear blue. My sister, on the other hand, wears aquamarine and amethyst and tangerine and colors I don't even know the names to. I hadn't gone home yet. This all happened all at once. I was wearing my sister's clothes. And my colleague, my manager, actually noticed and came and saw me and expressed her concern. And she linked it to the one thing that she knew was different for me. And she went, Louise, if it's the job, I know you can do this job. You've been doing it for years. But if you feel you need more support, that's what we're here for. Now, I did not react the way that maybe she expected, right? And that can happen. I burst out laughing hysterically. I guess I was more stressed than I thought. And I looked at her and I said, it's not the job, it's the kids. The kids are killing me, right? But at that moment, I realized I had never talked to my manager about it because it was a personal family situation, and I didn't link it to my work because I thought I was actually managing really well, and it never occurred to me that she could offer me some support, which she did. She offered me the one thing that I needed at the time. She told me I could work from home, right? That we were all able to work from home, which was closer to the school, it was closer to the hospital, and I didn't have to get dressed in the morning, right? And I don't know, but it takes a lot of energy just to get dressed and put the makeup on in the morning. I didn't have to do that anymore. And she also told me, she's a friend as well as a colleague, she said, if you ever turn your computer on again at 2 o'clock in the morning, we'll have another discussion. That's not acceptable. Right now, the focus is your family. And I know you'll make it up because you always do. And that's all I needed at the time. Now, I didn't go right back to green. That wasn't going to happen for a long time because Paul's condition was so out of control. But I got back to yellow, which was enough to manage it. But I was already into orange, going towards red. And it was my colleague who made me aware that I wasn't taking care of myself, that my mental health was deteriorating. So does it work? Yes, on an individual level as well. People can feel more valued and more supported. So these are things that we've talked about throughout our discussion today. I just put them down on paper so that they'd be there as a reference for you. So what do you do as a manager? What do you do as a colleague? But what I'd like to focus on today as our last focus is what can you do for yourself? Now, 3 years ago when my life went into a bit of a chaos, I didn't take the time to take a step back and go, okay, is this healthy for me? And I don't think I could have at that time. It was new for me, and I was just reacting. But when things get difficult, it's important, if at all possible, to take a step back and say, am I still in the green? And if not, what can I put in place of strategies to help me stay in the green or the yellow? And if our colleagues, our friends are there if we can't do that in that time, so that they can be a mirror to ourselves when we can't do it ourselves. But to think of yourself as well and to put in place strategies to be able to address it. For example, Paul, my brother-in-law, was ill again right before Christmas, and he had to go to the hospital, and he stayed there for about a month. But this time we have strategies in place to manage that none of us feel as if, you know, we're overwhelmed, if at all possible. So it's to remember that there is no health without mental health. We're entire people. Our physical health, our emotional health, our mental health, our psychosocial health, they all link together. It's important to actually focus on mental health and to make sure that we're healthy and that we can thrive. And that investing in mental health in the workplace actually is an investment. There's quite a return for that, for the individual, but also for the organization. And there are resources to help. We're not alone in this journey. And so including the national standard, including the federal public service strategy, to be able to actually create that work environment that we want, that mentally healthy work environment. So before I pass it back to Tina for questions, I also wanted to highlight some resources that are available to you as an employer or as an individual that you can use to promote mental health at work.
Thank you again, Louise, for your presentation today.